We're back with neutrophil behavior. We are still on innate immunity, okay? This is like you were born with this ability. You got bacteria, you've got all of these things happening. You've got your oozy leaky capillaries, diapedesis, you've got chemotaxis, you've got inflammatory chemicals, you've got phagocytosis, right? All of those things are happening. You have fibrogen. Do you remember fibrinogen is what is going to help with your platelet plug, right? It's going to prevent pathogens from spreading through the body too. It's going to filter into the tissues and it's going to form a sticky mesh, which is going to wall off the bacteria. Just like it stopped a clot, your fibrinogen is also going to stop the movement of the pathogen. So it walls it off. The pathogen is hopefully in a fluid pocket surrounded by the clot. It is attacked by antibodies. It's phagocytosed. Also, heparin prevents the clotting at the site of injury. So that's another situation that happens there. But the fibrinogen, which was really important in your platelet plug, is going to come back to us here and help us wall off those pathogens. Neutrophils, these accumulate at the injury site within an hour, right? So like as soon as somebody knows that there's a pathogen, neutrophils. After leaving the bloodstream, these neutrophils attack and basically guide to the injury site, they phagocytose, and they digest the bacteria. They secrete cytokines, which, remember that because we're going to talk about cytokines again. They recruit macrophages and additional neutrophils, and macrophages and T cells, which secrete stimulating factor. They stimulate leukopoiesis, which is the production of more white blood cells, right? Okay, so bacterial infection is your neutrophil, eosinophils are your parasitic infection. And these are just, again, more things you're doing. This is a bigger picture in case you couldn't see it before. You've got a pathogen or wound, right? You've got tissue repair. You've got a macrophage, which is just going to, right, Pac-Man it. And then what is it going to do? It's going to post it on its MH2 or MH1 platform, its Facebook platform, right? It's going to be like, hey, this thing, right? Here it is. Here's the thing I ate, right? Then we're going to see a bunch of vasal leakiness. You're going to see more phagocytosis and killing. You're going to see the neutrophil here. Monocytes arrive, again, 8 to 12 hours and become macrophages. Look at that guy. He's just going to eat that thing. He's going to post it on his platform. He's going to make these membranes leakier. He's going to do all kinds of things. He's going to engulf and destroy the bacteria. And he's also going to find dead and dying neutrophils and phagocytose those. Here we go. Bigger picture. Here it is again. Antibody, antigen, complement, MAC attack. That's going to clean everything up a little bit. Inflammation, edema. Remember, we talked about this when, I don't know why you would stab yourself with a nail. No idea why. But look at this in terms of what we learned about the lymphatic system. Okay? So here is your, right, you have a capillary that's been broken, right? Seepage of fluid is coming out of your capillary, right? What is that going to cause? It's going to cause all that interstitial fluid and your white blood cells. That's going to swell, right? Edema. And it's also going to produce pus, right? I hope you're not eating. Sorry. So you've got swelling of all that interstitial fluid, veins, forces your lymphatic capillaries open, promoting lymphatic drainage of bacteria, dead cells, and debris. And you're also going to get pus, yellow, and that is like dead neutrophils, bacteria, cellular debris, tissue fluid. And an abscess is actually an accumulation of pus in a tissue cavity. You're welcome. And here again, stages of inflammation. You see this as it breaks, it just opens up, and that's where you're going to get pus and edema from. Okay, there's some cleanup there. Just your platelet growth factor stimulates fibroblasts, increase heat, right? You're going to be hot, like if you have a fever, but also if you're inflamed somewhere, it's going to be hot to touch in your skin. You're like, oh, that's like a feverish sort of inflamed situation. That increases the metabolic rate. It increases mitosis. It calls your white blood cells it's bringing the blood, it's bringing the white blood cells. That's why you're going to feel hot to the touch. It forms a fibrin clot, just like what we talked about, like a platelet plug. And pain makes us limit the use of that body part because it's hot and it's swollen and it hurts. So it forces you to sort of rest it. If you like have recently like twisted an ankle or messed with some kind of a injury, like, stay off it, relax it. That's intentional. Your brain is telling you to knock it off. Okay, active and passive immunity. That's what we're getting into now. Okay, active immunity. Basically, this is exposure to a pathogen that triggers an antibiotic reaction, right? This is like your body has learned. Now, this can just be you got an infection and your body learned, like my chicken pox, or you actually got a vaccination against it. Before, we were talking about passive immunity. This is just what we had before. We had basically what you got from your mom when you were born, maternal antibodies, and some other antibodies that your body just formed over time. So, adaptive immunity is your third line of defense, right? This is like over time you develop this type of immunity. It acts throughout the body. It's incredibly specific, so specific. It's going to only go after bacteria that your body has seen before. It's going to generate protection and immunity to specific pathogens on a very individual basis. And it has memory. It's like, dude, you come back here again, I'm going to phagocytose you. That's what it's saying. There are two types. Two types, okay? You have humoral, which is antibody mediated, okay? Antibodies do not directly destroy the pathogen. They tag it for destruction by B cells. This is very effective against extracellular viruses, bacteria, toxins. And you have cell mediated. This is lymphocytes directly attacking and destroying foreign or diseased host cells. It rids the body of pathogens, and it acts against parasitic worms, cancer cells, and transplanted cells. Okay, again, antigen versus antibody. It needs to be said again. Antigens. These are the antigens. They bind to the antibody. This is an antibody. It has a bunch of different regions to it. Antibody. Defensive protein recognizes and bonds to antigens. They are protein molecules. They originate within the body. They are immune cells. They are blood plasma. They are lymph. They are tears. They have a paratope binding site. What do they bind to? Antigens. That can distinguish self from non-self. Remember, you're going to fail out of school if you attack yourself. Usually they're proteins, sometimes they're polysaccharides, sometimes they're nucleic acids. Originates within the body or external, and they have an epitope binding site. Okay, so you have two, right? Here is my version of the same thing, looks exactly the same, right? Humoral, your B lymphocytes, born in the bone marrow, right? Goes to school in the bone marrow, receptor is an antibody. Cell mediated, it's T lymphocytes, also born in the bone marrow. T, thymus, goes to school in the thymus, goes to school in the bone marrow, hence B lymphocytes, T lymphocytes. Get it? Educated in the thymus, has a T cell receptor versus an antibody. Okay? Yes? Haptens are incomplete antigens, and then all of a sudden you have a complete antigen. This is like before you're an antigen, you're a hapten until you find a carrier. It's just, these are really important to allergic reactions. So hapten binds to a host protein in allergic individual, creates a complex bind to mast cells, triggers a massive release of histamine, like massive, and in very severe cases, what's going to cause your anaphylactic shock because your body is free. Okay, went to lymphocyte school, right? They picked a receptor. Where these went to school in the bone marrow, these went to school in the thymus. You picked a receptor. You were naive. You went to school. You went to negative selection school. Will you attack yourself? 90% fail rate right here. Really hard school.